Hi, my name is Reft. I'm an instructor in the Physical Therapy Assistant Program and Morton College program in Cicero, Illinois. This is a PNF video, and it's specifically to help my students who are taking 212. I'm going to demonstrate some of the different PNF techniques. And the reference that I'm using is Neurological Interventions for Physical Therapy by Martin and Kessler. So first I'm going to demonstrate some of the techniques to go under the mobility stage. One is called Rhythmic Rotation, and that involves lower trunk rotation. So the subject has their knees bent in a hook-lying position, and it's a completely passive movement. So the instruction is for the patient to relax, and you passively take the person through lower trunk rotation. Rhythmic rotation is commonly abbreviated capital R, R, and small o, but it's a passive movement. Another mobility technique is called Rhythmic Initiation, or RI. Rhythmic Initiation also involves lower trunk rotation, but it's a little bit different because it is not completely a passive technique. It's actually kind of a progression. So to start Rhythmic Initiation, you tell the subject, I want you to relax, and I'm going to move you through the movement. And so you start passively, and then you ask the patient, I want you to try to move with me. So encourage them more active assistive, and then progress them to an active movement. So I want you to actively move your knees back and forth for lower trunk rotation. And then I'm going to try to resist you. So try to push against my hand. Okay, and come back and back. Okay, relax. So Rhythmic Initiation is by definition a progression from passive to active assistive to active to resistive. And no, you may not do that in one session, but it does aim for the progression, whereas Rhythmic Rotation is just a passive movement. So those are the two mobility techniques that kind of involve functional movements. The other mobility techniques I talk about are typically done for the extremities, so they may be done in terms of a diagonal PNF movement or in terms of a straight plane movement. So one of these techniques is called hold relax, and it's classically used to increase range of motion, especially it's used a lot for hamstring tightness. So for example, if you have somebody who's limited in their straight leg raise, and the idea is that the hamstrings are limiting them, you want to activate, basically it's an isometric contraction of the antagonist to try to increase the range of motion. So I'm going to have her leg on my shoulder, okay, and again this is called hold relax. So that you ask the subject, I want you to push into my shoulder. Okay, that's the hold part. Relax, that's the relax part. And then I try to increase her range of motion. So I'm going to ask you to push into my shoulder, okay, and relax. And then I bring her up. So that's hold relax. In PNF, hold usually means an isometric contraction. Okay, so she's holding an isometric contraction, relax, she's relaxing. And that's typically moved to increase range of motion. It can also be used in the upper extremity. Okay, same idea, although it may not be the antagonist that's limiting you. For example, if I'm trying to increase her abduction, I can ask her to push down into my hand, relax, and then bring it up. Push down, and relax, and bring it up. Okay, a little bit different because it's probably not her extensors are limiting her, but you could still use it. Another mobility technique, more for movement initiation, is called hold relax active movement. Okay, I'm going to have you roll on your side towards me. And so the way they describe in the Martin Kessler book, they give this example for scapular elevation. And so the idea is that I'm trying to increase her scapular elevation, and I'm going to take her scapula and kind of move it to an elevated, just relax, move it to an elevated position. Okay, I'm going to ask her to push against my hand. That's the hold. I want you to relax. Okay, and now try to pull it back up. Okay, and now push against my hand and relax, and try to pull it back up. Okay, and relax. So hold, relax, active movement, HRAM. So again, the hold is an isometric contraction, the relax is a relax, and then the active movement, she's pulling it back up. And you may add in there a quick stretch, okay? So after she does, so I want you to push into my hand, after she does the hold, relax, okay, relax yourself. I can pull her down and then have her pull it back up again. So you can add a quick stretch in there. But by definition, it's an isometric contraction, followed by relaxation, and then pulling it back up again. Hold, relax, active movement. Okay, come back on your back. Another technique for mobility is called Contractile Acts. And this is something that's used for strengthening, and the person has to have some pretty good range of motion and movement to do it. So for example, if I was going to do, try to increase flexion strength, and having her do the D2 flexion pattern. So have you bring your arm out like this. Okay, bring it back in. Contract, relax. I'm going to give her resistance, and I'm going to try to resist everything but the rotary component. So for the D1 flexion, I'm trying to resist her flexion, and I'm trying to resist her abduction, but I will let her rotate into external rotation. So you can push against my hand, or you're coming back up, okay, and then we can go the other way and come back down. Okay, that's contract, relax. And no, I can't tell you exactly how you resist the rotation. Okay, it's a little tricky, but that's how it's defined. Okay, go ahead and sit up. So and have your hands, legs over the side. Two techniques that are used for stability are alternating isometrics, or AI, and rhythmic stabilization, or RS. In both cases, they're typically used for trunk control, and alternating isometrics, you're going to go from one side to the other, okay? So I'm going to have her push into my hands, okay? And then push the other way. I can also tell her, don't let me move you, and I can try to push against her in both directions. So the idea is that she has to keep using her muscles, right, to hold herself up. That's alternating isometrics. Rhythmic stabilization also focuses on trunk control. It's also going to promote an isometric contraction, but this time there's a rotary force involved. So instead of pushing her one direction or the other, okay, it's going to be kind of a twisting motion. So I want you to resist my movements, and now I'm going to push on either side, almost like I'm trying to twist her, okay? So again, alternate isometrics, one side or the other. It could also be done side to side for AI. Rhythmic stabilization, also trunk control, but it's going to be more of a rotary force, almost like I'm trying to twist her. And those are the two techniques primarily used for stability. And again, they're almost always used in conjunction with trunk control, okay? But they can be used in different positions. So for example, if you want to stand up, I could also do the same thing standing up, okay? Don't let me move you, one side versus the other for AI, or for RS, again, in that rotary position. I can have her, if you can come on your hands and knees on here, I can do it in 4 points, okay? Same idea for AI, don't let me move you. Try to push her here, try to push her here, or even try to have her kind of rotate. Again, I can have her in 2 points, so go on your knees, okay? Same idea, okay? Don't let me move you this way, or this way for AI, or for rotary, this way for rhythmic stabilization. Okay, and those are the two movements used for stability. Okay, if you can sit up on the side. So there's three techniques that are used more for controlled mobility and skill. These are more difficult techniques and utilized for people who usually are moving pretty well at this point. One is slow reversal. And slow reversal is basically resistance to a concentric contraction throughout the range of motion. It can be used in terms of an extremity movement, or it can be used in terms of a functional movement. So for example, if I wanted to do slow reversal for the D1 or D2, we'll say flexion extension pattern, okay? So I'm going to have her do the D1 flexion and extension, okay? So you're going to come out and come down. Now I'm going to give her resistance now. So I want you to pull up against my arm, okay? And then I'm going to switch and have her pull back down, okay? So pull up and pull down. So in slow reversal, it's a concentric contraction going both ways, okay, because I'm giving her resistance. Slow reversal hold is the same thing. However, this time at the end of the range, you add an isometric contraction to it, okay? So doing the same thing we did before, I want you to push against my hand, okay? I want you to hold it there, okay? Now we're going to come back down, push against my hand, and we're going to hold it there. Okay, so again, hold in PNF parlance always means an isometric contraction. Okay, you can also do slow reversal for a functional movement. So for example, if you want to get on your hands and your knees. This way? Yeah, that's fine. Okay. Okay. So I can tell her, okay, push against my hands back here. Push farther, push farther. Good. And then come forward, push yourself forward, and push yourself back. Okay? You can go on 2 points, go up on your knees. I can do the same thing here. So kind of push yourself forward, okay? And then come down like a squat. Like you're trying to squat down towards your butt. There you go. And then come back up. Okay? So that's slow reversal. Resistance against a concentric contraction. So once you come on your back with your knees bent. Agonistic reversal is probably the hardest technique for patients to do, and this involves a concentric followed by an eccentric contraction. The most common example of a agonistic reversal is for bridging. So you have the subject do a bridge. You're going to lift up and come back down. I'm going to give her resistance in the same direction for both movements. So I'm giving her resistance as she comes up. That's a concentric. I'm giving her resistance going down. The instruction is to lower your bottom slowly against the resistance. So coming up, it's concentric. I'm giving her resistance, and coming down, she's supposed to come down slowly. Okay, and that can also be done as an extremity movement. So if you want to sit up on the side of the mat. So in theory, I could have her do the D1 flexion pattern. So bring your arm across here. So giving her resistance as she comes up. Okay, and then asking her to slowly lower it as she comes down. Okay, it can also be done in terms of a functional position. So for example, having her, if you want to sit on the stool, let's see this, but we'll try it. Yeah. Giving her resistance here as she comes to stand up, okay, and then still kind of pushing on her as she comes down and trying to have her control it. That's agonistic reversal. And yes, it is a harder technique, and it's not going to be appropriate for all people.